Welcome to a brief demonstration of the Hermes Medical Solutions liver remnant analysis tool. The purpose of the application is to predict the post-operative liver function which a patient undergoing liver resection surgery will expect. So we can see we've got loaded here a dynamic HIDA scan. This is actually a geometric mean image which has been made by the program on input of the ANT and POST series. We also have a SPECT CT over here that was acquired directly after the dynamic. So to start the processing, we draw the regions specified in this window. So I'm going to start with the blood pool, and I'm going to choose this bit here to draw it in. So I'm just clicking and dragging there to make that blood pool region. Now, immediately the program moves on to the next region, which is the liver. And we have a nice seed tool here to be able to outline the liver. I just drop that there. And then the remnant liver, so this is the portion that will be remaining after the surgery. So I'm going to just click and drag again to draw that, and this will be constrained to be inside the other, the liver region. So we don't have to be too accurate around the outside there. So you can see that these results here have now been populated. I will give a description of these at the end, but just briefly. So we've got the uptake in percentage of the injected counts per minute. We have that normalized to body surface area that's taken from these weight and height measurements up here. We also have so this is the ratio of the total liver uptake that the future remnant portion will be, and that's just a straight count ratio from this planar calculation here. And then we also have that normalized to body surface area for the function. The HIDA clearance at 15 minutes, that is calculated from this fit down here. So if I take off all of these, apart from the blood pool, you see here that we've got 6 minutes worth of data, but we have this dotted line underneath the dashed line that was extending out to 15 minutes, and we can make an extrapolation to 15, calculate what we expect the blood pool to be there, and then calculate from that the HIDA clearance at 15 minutes from the blood. Let's put these back on again. But to make this more accurate, this calculation of the future function, we have to draw these regions on the SPECT instead, because this planar calculation doesn't give much room for accurately defining the anatomy of the future liver remnant portion. So I'm going to go over to the SPECT now for that. And we have a few ways to make this easier. So I'm just going to use these constraints here and just draw which portion of the liver will be remaining. So I'm going to draw a constraint on this one. And then if I wanted to, I could draw a constraint on a different region as well, but we'll leave it at that for this demonstration. Then I'm going to choose the liver volume here, and I can do an absolute, so this is a count threshold of 2000. So that means that anything more than 2000 counts will be included in that volume. So we can see that's made quite a nice volume there. The next one is the remnant volume. So I'm going to choose that one, but then, so it's the same threshold, but this time drawn, I'm going to make a double click inside that constraint. So that volume then is just constrained to be inside that previous region that we drew. The last thing to do here in the processing is just to mask out the biliary tree here. So we can see this uptake, which is not the functional liver uptake, it's the biliary drainage system. So we don't want that in the calculation of the count ratio, because that would make an inaccurate result. So I'm going to just make a double click here. It's going to choose the sort of hottest portion of that and set it equal to the mean counts in the rest of the liver. So in that way, we can remove the influence of those counts from the calculation. And there we go, that's finished. So now we have these SPECT versions now of the ratio calculation between the whole liver and the remnant volume. So rather than the area counts being taken here, the volume counts have been taken from the SPECT, which is much more accurate. Just to look at the final definition of the results, this is what we are calculating for this patient. that was a brief demonstration of the liver remnant analysis tool from Hermes Medical Solutions.